Get to chair myself and to reduce Kathy's anxiety at the front here, I suppose I should say I'm usually quite good at timekeeping, but I suspect if I'm not, she'll be jumping up and down and waving at me. So I'll turn this way so I can't see her. So thank you very much for the opportunity to be here today. And what I'm going to do today is presenting to you not my story, nobody's story. It's a real bringing lots of things together, really, some things to really think about. As I said at the beginning, I'm a nurse and I work at Great Ormond Street, and I'm predominantly a researcher. Today it's about early diagnosis. We're going to talk a little bit about current research, and really the discussion is really just to present to you the kinds of discussion that is happening. We did a debate early in the year as part of the CCLG's winter meeting. And that was sponsored by the Adam Hay Foundation. And we were thinking about, the topic was, why can't we improve the timeliness of a cancer diagnosis? And we had a number of speakers there. And there was a lot of discussion from the floor. I can't present that to you today. So what I wanted to do is to reflect on some of that debate a little bit. So I can't share all the points, but you can look at the CCLG website and you can see the films there. My job today is really to weave more of a story, if you like, one familiar to all of us in the room, using pieces of information, what a researcher never does. So just small pieces brought together. And really then for us to think at the end about what kind of intervention or change might be required, if indeed we think there is a change required. So this is me going to knit a story for you. And I've just taken here some information from Find Yourselves of Tumour. Many of you will know a little bit about that patient-focused conference that happens. And I've just taken one, and I can't tell you what year this was, but I just thought it was quite useful to show. So the question always asked, remember, they do handheld responses to some of the questions. So how many times do you visit your GP with symptoms? And I think the thing for us today is here, 4 times or more. So nearly 30% of those people were going more times. And you'll see that as a message throughout my 15-minute talk. And that's something that we may want to come to at the end. So when I was thinking about what to present, I was thinking there's a lot of information that we have. We've got quite a lot of research, and I'll say a little bit about some of those things. And we've also got a very strong patient and family voice. And we have some strong, if I could spell strong, that is, strong views. And mustn't have had my glasses on. And I thought, well, if you were to bring all of these things together, and I think that's the important message here, it's this and this, it's the research, and it's these two things working together that I think is going to move us forward. Because it may be that that's how we bring it all together, but actually there's a piece of the jigsaw missing, and that's the bit I want to talk about today and come back to at the end. So, and this came from Rachel Dommett at the debate, her slide. So what she started us off by thinking about the kind of things that we read about, the kinds of things that families say to us, or the kind of things that have been said to families. So these kind of things, just a virus, she was an anxious mother, it's just growing pains, families are very angry, and these are the messages you get from the press, delay kills. And this is the kind of stuff we're seeing in terms of what they're calling the diagnosis lottery, in terms of where you are and how, and this is all adult stuff, as you can see there, in terms of delay in what they're calling delay in diagnosis. And there's a stream of research that many of us as researchers in the audience will know about, and that's the National Awareness and Early Diagnosis Initiative, which I'll come back to at the end. And the reason why I want to put it up flashing is it's very, very, very important. But actually the majority of the funding so far has gone to work that's related to adults. Not surprisingly, in some ways, because of course we're only 1% of the population, but we might come back to that in our discussion. But I wanted to share this with you, and I know it looks a little bit busy, but this is something that we as researchers are kind of trying to think about when we think about this thing that's been called delay. So what we're wanting to think about is what kind of things do we need to consider that influence that? And that could be some disease factors. There could be something about the healthcare providers who you see first, whether you go to accident and emergency or whether you go to your GP. And there could be some patient factors. There could be something about not knowing your own body, not knowing when something is an important symptom or when it's something that actually it's quite normal. It's trying to distinguish those things. So there might be some things there. And all of these things lead to this line here. So there has to be some kind of appraisal, you as a person thinking something is wrong. Then you seek some help. And then a diagnosis is made, and then you start to move along this pathway. But there's lots in here we still don't understand. And it's not straightforward. If it was, then that bit of the jigsaw would be fitted in. So there's lots of information we don't have to fill this. And again, I'll come back to that in the end and point out where I think we need a little bit more information. But that's what we're trying to help us in our research thoughts. But that's also something that we want to use with families to think about, well, what might we need to know here, particularly when we might be talking about young people, that might affect them from going to their GP. So, these are the kind of things we see all the time. You don't have to read all of these things, you know what these things say. It's all about GPs come under the microscope, in the spotlight, all of the time. Hold that thought, because I want to come back to that at the end. But these are the kind of things that hit the press. These are what we might call sound bites. They're important sound bites because, of course, they are somebody's story and they want to tell that story. And here we see here things that I spoke about at the beginning. Anger, the diagnosis being missed, rushed back into hospital, those kind of things. These are the things we see all the time, the things I see when I switch on my computer and I get these messages that come up about the news of today. But there is some work that is happening, and we've got some cancer awareness initiatives that some of you will be aware of. So there's the one down here, Head Smart. We've got some things which Teenage Cancer Trust are doing. So there is some awareness initiatives underway, and there's also research that's looking at some of that awareness. So in terms of young people, trying to find out what do young people know about cancer, what kind of things would they look for, what kind of signs and symptoms would they look for. And here you have some work that's been done with younger children. So there is something about awareness, but of course awareness comes with a proviso, and again we might come back to that later. But what about some of the other research? We said at the beginning, I can't tell you everything about all the research. That would be unnecessary today. But there were a couple of things I just wanted to highlight. So this is one in particular, which is a systematic review, which was done by colleagues here in the UK. And I've just picked out some of their concluding thoughts. So, and I think the bottom line is this one here, that it's not clear. And the reason why it's not clear is that a lot of the research that's undertaken in this area is different. We're not using the same frameworks. We're not asking the same questions. We're trying to compare things which are not like with like. So it is very, very complicated. And you see some interesting things that are said. So decrease in survival with increasing time to diagnosis, no difference in survival, so we don't know what's the outcome that we should be looking for. And cancer biology in response to treatment are likely to be related factors. There's lots we're learning, but we haven't brought them all together necessarily with some patient groups, and that's why that bit of the jigsaw is still missing. So that's some research that's been done. Then you've got some work that Rachel Dommett spoke about when she was at the debate, which is a population study again, which was looking at the consultation, how often did young people go along to see their GP? And here you see here, attending their GP 4 more times. And remember I said that at the beginning. So frequent visits, what do we want to do about those frequent visits? Is there something different that we should be doing? Here's some work that we did when we talked to young people about the time at which they thought something was wrong and their pathway to then getting specialist care. And again, I've just pulled out some things for you here. So it may be that we need to help young people. And I've added parents in here. We didn't talk to parents in this study, But I think you can apply the same things across. To tell their story, bring their timeline and details to any meetings. We may ask stories of other people. Certainly in this study, we found that a lot of young people got advice from their next-door neighbour or from a friend at school. It wasn't necessarily professional help they were seeking at those early stages. And then the last thing, just to point out, do we allow enough time to tell a story? Rethink GP appointments. How long do you have? Is there something about a red flag system? But we can come back to that. So, a bit more research. This is more recent. Again, this was talking to parents of children with cancer. And this was done in Australia. And there's a couple of things, and particularly from what Ron was saying, that I want to point out, is what they conclude in their work is that we need some interventions to assist families that are at risk of delay-associated distress. Something happens at that point, and they continue with this distress for some time, and that then may affect these things. It may affect them encouraging the young person to come back for screening, follow-up, but it might affect the whole family adjustment if they're carrying with them something that relates to that early period of the diagnosis, and some of you may have experienced that. And we need to balance education about cancer symptoms, so that's that notion of awareness. How much awareness do we do, and that balanced against what people in raising their anxiety early on. So then we've gone on to do a little bit more research, and again, I can't share all of these things with you. I'm just going to take one part. We've been doing some work which was originally called Optimal Routes to Cancer Diagnosis, and this was across the population of children and young people. And we've got these 4 elements to the work. Talking to parents is down here, and I'm just going to take this bit of data here for you. And we've been doing some interviews, comparing GP notes, and et cetera, et cetera. So the full story's not here because the study's not finished, but I've just brought a few things from here for you. So we did some data collection thanks to the Bone Cancer Research Trust, and that was the group that we spoke to. It was only small, so it was mothers, fathers and siblings, and we had people there from the charities, and these were the diagnostic groups you see here. And this little comment here is not necessarily to do with my talk today, but I just still wanted to put it up. After we undertaken the focus group, I just want to read this quote. So, may I just add how nice it is to be a bereaved parent and be part of research, because we are rejected in many situations because it might upset us. And those sorts of reasons, but actually they had an awful lot to say. So that's just something to be mindful of, particularly those who are researchers in the audience. So what did we get from that? That families spoke about things that facilitated diagnosis. So this was a GP. This was in South Africa, where imaging was routine by the GP. This mother thought that was helpful. Parental input. So the dad had enough, wondered what was happening, took the young person to A&E. And again, another family who took the young person straight to A&E, no appointment, seen straight away. What was a barrier? Lack of awareness of cancer in young people. I didn't know what oncology meant. It just wasn't in our lives. What did it mean? And again, I can see people nodding. That's quite a common, and quite rightly, as it should be, that you wouldn't necessarily know until it comes knocking at your door, sadly. Imagine not being carried out early in symptom evolution. So it's picking things up early. So families, I know, get frustrated that some of these investigations don't happen early, and there's lots of reasons for those. And other events, and I think this is a common story, particularly with young people. It's a sporting injury, it's a growing pain, it's a whatever. And of course, we're often going to look at some of those things as opposed to think about it being cancer at the outset. So just a couple of things I wanted to share from here. Some things we've already got in terms of our early learning. So I mentioned at the beginning that systematic review. Well, often what we find is there's poor quality literature and it's not clear, so we can't make any decisions based on some of these things. I, as a quality researcher, am particularly interested in families' views and young people's views. What have we found so far? 6 studies where we've talked directly to young people, not about diagnosis, but there's something in that story about the diagnosis period, and 10 that have spoken to parents mainly, not younger children, and they're from some time ago, they're not recent. We know that people have more consultations, so there's a related, is the GP asking the right questions, looking at the right symptoms? What else do I want to pick out from here? This bit here, because I mentioned that at the beginning. So the UK-wide priority to improve diagnosis, which is that NADI research I spoke about, more focused on older adults with cancers for all sorts of very good reasons. And this last one I just wanted to point out. Time is not the only marker of a good diagnostic experience. So funding for quality of research is difficult to obtain, but as you saw from that work in Australia, families can be left with distress. So it's not just about making sure it's quick, it's making sure it's a good experience, if that makes sense. So I'm going to go back to that one. Remember, I had that at the beginning to say that this is something that we're using to direct us. And I suppose what we're thinking about is where are the gaps, what don't we know yet, and how can we fill those gaps? And where are the gaps, as we can see as researchers, certainly, in terms of understanding appraisal, what people think about their bodies and moving forward, and that's for younger children as well as young adults. When does help-seeking behaviour? We don't know a lot about that. There's still a lot more we need to know. And what happens when people go to the GP? What's the response? And here and here. All of these remain gaps yet to be filled by research that includes the voice of those people who've gone through the actual experience. So we're trying to raise the profile. We have written an editorial in the BMJ. And again, I just put at the bottom here a comment that we got. And I don't want to give you a sense of me sharing my failure up here, but we've been rejected on a number of these grant calls, and that's the life of a researcher, really. We're quite robust, we bounce back, but this is an interesting comment here. This is what we got as one of our feedback. The case that suboptimal total intervals were a problem in the UK needed to be stronger, as some members of the panel, that was the panel that were looking at our research, were not convinced there was a need to do research in relation to this period. So it's something about what we write, something we're writing for, to get that message across, that actually these gaps still remain and we need to fill those gaps. So I said at the beginning, I said something about GPs, and I've just got 2 more slides, and I think I'm okay, yeah. So this came from the GP who spoke at the debate, and I wanted to, I forgot about him coming up, yes, time for change. So this is the GP, that wasn't the GP. These are the things to remember, and so a cancer diagnosis in a young person may only happen once in a GP career. Many of you know that already. GPs only have 1 chance to get it right. It is also a tragedy for the GP if there is diagnostic delay. But there are a number of things that make it difficult. And what they're looking for, what they want is clear referral, some guidelines. You can use risk assessment tools. And there is quite a lot of work now around symptom-based awareness campaigns, which I've said, and ways of getting this traffic light system, so you're looking for something in particular. And some GPs have advocated 3 strikes, but the numbers don't work. So 3 strikes, if you go to your GP 3 times, then something else happens. These things may benefit, I've mentioned these things already. But his main story was, and I am inclined to agree with him, this is very complex, very, very, very complex. And this isn't the only answer. And again, I think, I just want to do that one first, but I agree with Rachel, who also spoke at the debate, is actually where are we looking? And we may not be looking in the right place, and we may be focusing on one element, which could be the GP, the encounter with the GP, but it could be many more things than that. And so, and just to go back, I'm very fortunate to be working with a large group of people who are trying to address this problem. And a couple of people I want to particularly mention. Some of you will know Stephen Sutton, who sadly died, but he was very instrumental in some of this work. He himself had a late diagnosis. So we're working with patient groups, epidemiologists, and nurses like myself, and clinicians. So there's quite a lot of work, but we're yet to get funding. So if there is a funding body in the audience who've got a couple of millions just in their pocket, I'm here all day. So just to think, we may not be looking in the right place. So just bear that in mind. Thank you for listening. We'll hold any questions. You can scribble down anything you like, and we'll come back to that when we've heard from Danielle, because this all kind of links together in terms of advocacy. So thank you very much indeed.